like to present the Stereotype Threat in Healthcare study by Cleopatra Abdu and Adam Fingerhut. It will be presented by myself, James Hill Jr. I am currently a USC Davis School of Gerontology student. I'm a former Navy sailor, and I plan to use my MA degree to work as a case manager at a VA hospital working with elderly veterans. A continuation of who I am. As you can see, I enjoyed my time in the U.S. military, and I look forward to my role serving other veterans and citizens of this great nation. I enjoy music, travel, and currently I reside in Washington State. Once again, did I mention I was in the Navy? So with the fleet out in the Indian Ocean, as we like to call the IO. The study of stereotype threat in healthcare. Stereotype threat in the healthcare industry is a theory that was never conducted or thought of in the past. Stereotype threat has usually been applied to standard academic tests and in the role of sports in the sports field. However, with stereotype threat in healthcare, there explores the question of disparities that exist in the medical field. And this comes about with African American women and people of color explaining how they feel they don't receive the same treatment that their Caucasian counterparts receive once they go into a physician for treatment. Stereotype threat is the first of its kind theory being applied in the health sciences. It came about with the hypotheses of these two researchers with the thought of if stereotype threat exists inside of the field of sports and standard academic tests, what may individuals experience in the healthcare setting? And this is a theory. The hypothesis was that stereotype threat, as noted, is a threat of being judged or confirming negative group-based stereotypes experienced in healthcare settings, and is one that's been overlooked, that has serious social barriers implications that can contribute to health disparities among African American women. And what is stereotype threat? As noted, there was a study that's been popular in the social science spanning over 15 years and demonstrating the contributions of stereotype threat to the ethnic differences in performance on standardized academic tests as well as in the field of sports. And now these researchers would like to apply it to healthcare, because the effects of stereotype threat can help in the healthcare field. Many of the participants of the study, African American women, after being exposed to stereotype threat, experienced anxiety after the study once they took the questionnaire. And knowing that anxiety can contribute to real-world consequences in our everyday health, the study can provide an insight to the serious health implications of high blood pressure, stroke, diabetes, and generational future generation health issues that many African Americans and people of color possibly can experience. Anxiety can cause psychological and physiological, cognitive, and behavioral consequences with prolonged exposure, being linked to long-term morbidity and mortality. The study used African American women and Caucasian women because of the thought that would the Caucasian female receive preferential treatment going to see the same doctor. And the study actually used a virtual waiting room for the women to actually be seated. Some of them inside the waiting room actually had negative images of African American women and people. And in some of the waiting rooms, there were just basically a normal waiting room without the negative images. And these images can cause us to perceive a group, a culture, a race to be as we've seen based upon a generalization of one individual being applied, and it's actually being applied to a group of people. By the negative images, as noted, Caucasian doctors could perceive the anxiety and stress that African American women experience and coming from their own stereotypical view that African American women are always angry. So this causes their anxiety or stress related matters. The tale of two patients. We have African American patient and Caucasian patient, and illustration of the sad look of disparity and the disconnect with the African American female and her doctor, and the attentiveness of the Caucasian female and her doctor. The healthcare profession, I believe that this study could offer extreme work in which doctors and possibly interns and attendees would be able to use this to become better physicians, in which they, in a sense, would receive a sensitivity training so they can understand that their perceptions and stereotyping can have real-world issues, real-world consequences on the patient of color. The pros of the stereotype threat in healthcare study. As noted, the healthcare-related decisions of African American women can be impacted as far as the utilization of pregnant African American women in the healthcare. Anxiety by African American women, psychological and physiological effects of African American women experienced by exposure to stereotype threat in healthcare. And the cons of stereotype threat in healthcare. It lacked men in this study. And the researchers noted that, in a sense, I guess they didn't want to, muddy the waters with a gender and racial aspect. The study also lacked other minorities. In the future, the researchers stated that Hispanics and Middle Eastern men and women should be included in such a study. Lacked research on community settings, which would be a future endeavor in the healthcare field. Lacked research on the effects of a single provider for the patient. A patient strictly dealing with the one provider they see over a long period of time could make a huge difference in their care. And the real-world applications of the study. This study allows doctors to understand the social barriers in healthcare that might be contributing to and the need for them to address them. It opens the doors of informing public policy in the area of healthcare and disparities that exist. And the study also allows for effective intervention program targeting healthcare professionals to address the disparities that exist in the healthcare profession. In conclusion, I would like to state, stereotype threat in the healthcare profession will only cease when we as a people speak up and challenge its existence in a field that is about helping and not exclusion. Challenge racism every day and everywhere, and it shall end. Thank you.